The ordinary, long-of-period cardiac circumvent patients include waited for surgical has almost dual through Wales. Formal statistics show patients waited an ordinary of 79 days among April 2016 and March 2017, compared to 43 days in 2015-16. Wales is cladding considerably over the British NHS in 6 out of 11 of the major categories for procedures and diagnoses. Some figures include shown. The Welsh by the government told it was work to cut circumvent surgical waits. England's ordinary expect for a cardiac circumvent was 51 days in 2016-17, 28 days less rather than in Wales. The largest distinction among Wales and England was for hip operative, wherever the ordinary was 215 days and 82 days accordingly in 2016-17. Murag Williams of Llanrwys in Gwynedd has been wait more than rather than 18 months for a hip replace. I can go. It is morbid, I can go on the flats but I can't go up a mound. It starts to get hot and it starts to burn up and later it seizes up and I can't go any future. Mr. Williams told he was okay if he sat downward, heard or lay downward, addition, so perhaps I'm happy in a way compared to several human beings. I listen there in horrible ache all the period. It does do you sense a bit irate how if you were in England thou'd get it direct off. Wait times in Wales for the treat of cataracts, hernias and the diagnostic of cardiac illness were as well considerably much longer rather than in England. The Welsh NHS had shortened waits for renal transplants and treat for chief injuries time both of system written the identical results for the diagnostic of carcinoma. The results were painted of the title figures measurable in the clinic scene statistic of the British NHS and patient scene database for Wales, PEDW. Dr. David Bailey, president of the UK Care Associates Welsh Justice told, this reality how Wales once again lags over England in the most of wait and diagnostics times is frustrating. This issue is rather direct striker. Down there are not quite doctors' work in the Welsh NHS to manage in the always increasing workload and such how our work during the facility our work at power to ensure patients in the thoroughness they merit. These figures ensure one of the really few opportunities to comparison the productivity of several components of the Welsh NHS in the framework in England. It is the tertiary period we include run the statistic and the wide image has remained unchanged in far much longer ordinary waits in Wales in planned treat for cataracts, hernias and for almost 6,000 human beings who had a hip replace recent year. The unavoidable issue is if the is now the rule, and if so if how is reasonable politically for a Labour Welsh by the government that has been very crucial of the way the UK by the government has run the framework in England. A Welsh by the government representative told the PEDW information was more than rather than a year old and we do not use the information to action productivity. He added, down there has been enhancement in the long of period patients in Wales expect for treat, in March 2017 show a 57% enhancement on the top of August 2015 in regulation of the 36 one-week numbers. We nested a future £50 meter in August recent year to bring wait times and we wait to see future enhancement while the statistic for March 2018 are published. We are work to enhance cardiac circumvent surgical wait times and rate up diagnostic for patients. Welsh Prudent Public Health Representative Angela Burns told growing waits for cardiac circumvent procedures were deep about. We requirement and pioneering and shamelessly goal-managed policy to reduction wait times, but down there as necessary to be the will at Welsh by the government standard to take how down there is a severe meltdown of control at the cardiac of the Welsh NHS, she added. Blanket Cymru Public Health Representative Rhun API Orworth told his side had sequentially allocated the inadmissibly length wait times in the NHS. He's why we've been inviting for the Labour by the government to accept a more than strict attitude to operating Public Health Executive Board productivity, figure on the Scotch expertise how effectively diminished wait times in 2011, he added. UKIP Wales Public Health Representative Caroline Jones told, still once again Wales is cladding over England in Welsh patients possessing to expect much longer for urgent operative in spite us conducting more than per chief on public health rather than England. The obviously shows he's not on how lot cash we expend, but how ineptly Welsh Labour has been fleeing the NHS for nearly 20 years.